The biggest advantage is, I think, is the safety. We don't have randomized trials to compare this technique to heparin only, except this smaller Ultima trial. We don't have a comparison to systemic thrombolysis in terms of randomized trials. I think we will never have this, at least not compared to systemic thrombolysis. But what we do know is we have indirect evidence, which is the number of bleeding complications from systemic thrombolysis, where we know we have up to 10% of major bleeding, non-intracranial bleeding, and up to 3% of intracranial bleeding complications when we use approved regimens of TPA, which is usually 100 milligrams over 2 hours, in patients with PE. So for me it's quite clear, and also it's according to the guidelines, that we don't routinely use systemic thrombolysis for PE patients who are not in shock anymore. What we have learned from the evidence from the EKOS, and I think we have now data from almost 1,000 patients out, that the safety appears to be much better. Again, not randomized, but what we see is major bleeding of 2 to 3% in the data we have, and we have extremely few intracranial bleedings. We have, I think, 1 or 2 are published out of almost 1,000 patients. So this is clearly less than the 3% we see with systemic thrombolysis.
So the patency rate is, the primary patency is above 80%, and the assisted primary and the secondary patency are above 90%, which is brilliant. And regarding the Villalta scale, we could show that the successful treatment part of the group, which is above 90 patients, 92 patients, in this group, only 80%, above 80% had the freedom of PTS. And comparing it with the patients group in a non-successful treatment, which consists of 14 patients only, they developed a significant higher number PTS. So this shows me a real successful treatment tool. I think the biggest advantage is to lyse the entire thrombus from the femoral iliac tract, from the proximal femoral iliac tract, again, which is above the ostium of deep femoral vein. So this is the big advantage of this technique.
Millions are suffering chronic FEMPOP deep vein thrombosis all over the world, and most of the patients have non-healing venous wounds and hyperpigmentation, very bad quality of life, and venous claudication. And they are really suffering, and patients often told that there is nothing we can do about it, we just have to live with it. But I think we have some good solutions for this kind of treatment, because in our treatment protocol we get very good results with EKOS. Our ulcer healing rates and patencies are very well. We use EKOS catheter for this chronic clots, just for softening effect, and we use TPA also, just preventing acute thrombus inside of the vein. And we believe that if we keep open the vein at least 6 months, the ulcers are healed. And we're just trying to this for this kind of patients, because they have no solution. They went a lot of doctors, they've tried a lot of treatment options, but they have no solutions right now, especially for the chronic FEMPOP disease treatment. Access PTS protocol, it really works, and we feel that in our daily practice, because in my country we have 100,000 chronic deep vein thrombosis patients suffer from this kind of ulcers and low quality of life. We started 2 years ago with Access PTS trial and this kind of treatment options for chronic FEMPOP DVT, and what we saw that if we keep open that veins, the patient's quality of life will be very great and higher.